In a world with advancing biomedical technology for preventing, testing and treating HIV, it is disturbing that AIDS is still so prevalent in 2019. In Uganda, close to 26,000 people still die from AIDS, and globally, 1.1 million people die of AIDS every year. Dr. Alex Opio is one of the researchers of the study, and he says there is a striking variation in HIV prevalence at provincial and district levels. It provides precise geographical estimates of HIV prevalence.
When you move from one country to another, specifically if you look at the southern African countries like Swaziland, Lesotho, you find their HIV prevalence are much higher than 10% compared to the countries in the East African countries. And then in the North African countries, the burden is even lower.
He says changing the trajectory of HIV and AIDS in Africa requires that we continue to seek better ways to know the epidemic.
If you know your epidemic into much greater detail, that level of detail will help you to plan better. It will help you to target your interventions better.
In 2017, the highest estimated HIV prevalence at the second administrative level in Uganda was 12.1% in Bujumba County, Kalangala District. The lowest prevalence was 1.7% in Aringa County, Yumbe District. The study found that the largest number of people aged 15 to 49 living with HIV reside in Chadondo County in Wakiso.
This particular study, therefore, took the study at even a much deeper level, because it was now picking HIV infection cases and mapping them according to where they are located.
In this new study, the Central 1 region with districts like Mubende and Masaka ranked higher in HIV prevalence at 8%. This was followed by the Southwestern region at 7.9%. Mid-North region ranks at 7.2%. Central 2 with districts like Luwero and Nakasongola stands at 7.6%. Midwestern region is at 5.7%, and the West Nile at 3.1% is the lowest in the country. Dr. Opio attributes this to the various interventions to fight HIV and AIDS in those regions.
A number of interventions in the category of prevention. There has also been a prevention of mother-to-child transmission. But in the recent years, it now has translated to what we call elimination of mother-to-child transmission, because it has shown that there's a great positive impact.
The study cites a stagnation in the number of people living with HIV and AIDS since 2016, and this is why.
The quality of life of the HIV-infected people who are on a long-term antiretroviral treatment has significantly increased. And therefore, the survival, the life expectancy, the people who should have died are now what? Surviving.
Global funding for HIV and AIDS has declined since 2013, and it is anticipated that geographically targeted interventions might make a big difference in the struggle against the epidemic. Director General of the Uganda AIDS Commission, Dr. Nelson Musoba, explains the variations in financing.
In the MDGs, health and HIV were really a priority. If you come to SDGs, if you look at now the development agenda, global priorities are security, there are, climate change, there are different things. Poverty is because, and gender, because they are cross-cutting and they may affect some of these social services we are talking about.
We need to continue to mobilize both financing from the international community, but very importantly, domestic financing from within Africa.
The research recommends that international collaborations could help address persistent high prevalence in some areas.
Advocacy has to be maintained at the highest level. There's no room for complacency. that we are remotely. I mean, if we have to succeed, secondly, is the ability to use data at a regional, national, and subnational level, which is we have to know our epidemic. We need to know where the infections are occurring. We need to know who is infecting who and use the tools appropriately and deploy all the tools that are available at our disposition.
Dr. Musoba says Uganda is on track towards meeting the global set goals in fighting HIV. Walter Mwesije, NTV.